Hello and welcome to MedMinder's Pharmacology. So today our lecture is about anthracyclines, which is used in anti-cancer therapy. Anthracyclines performs 3 types mechanism. First, through intercalation, means incorporate into DNA and creates disturbance, inhibit the transcription and translation processes, which is essential for protein synthesis, which assists the DNA replication and inhibit the cancer cell proliferation and cancer further not progress. Second mechanism, through intercalation, forms stable complexes with topoisomerases 2 enzymes. As we know, the topoisomerases 2 and 4 help in DNA replication. So what the work of topoisomerase 2 is helpful to unwind the supercoils of DNA and assist in DNA replication. Anthracyclines leads to fragmentation or scission of DNA and ultimately cell apoptosis. Next, the third mechanism is generation of oxygen-free radicals, which leads to damage the cell membrane and ultimately cancer cell. Dioxygen-free radicals is generated through the quinine portion of anthracyclines under redox reaction, which is the combination of oxygen reduction reaction. Next, if we talking about pharmacokinetics, is clearly mentioned, but most important thing is the dark red color of urines and surrounding veins. Why is due to administration of anthracyclines is used FO carcinomas, which is cancer of epithelial cell and mitoxanthrones, specifically for prostate cancer. The most important adverse effect is cardiotoxicity, which can lead to heart failure, so should be cautionally administered in cardiac patient. Next drug is Bleomycin, which is cell cycle specific because it accumulates cell in G2 phase. Majorly cause scission of DNA by an oxidation process. Mechanism is clearly mentioned here. The important point for lungs Bleomycin is it can be inactivated by hydrolase enzymes, which is majorly present in liver, spleen and minorly present in lungs, so cautionally administered. Pharmacokinetics is clearly mentioned. Air and adverse effect us. Pulmonary toxicity caused by Bleomycin is also called Bleomycin. Lungs used for testicular lymphoma and Hodgkin lymphoma begins typically in an upper body part such as chest, armpits. Next class is alkylating agents. The drug included in alkylating agent S is clearly mentioned here. Major mechanism of alkylating agent is transferring of alkyl group to DNA, lead to mismatch of base pair and leads to mutation. It also forms coarse linkage bonding on the functional group of DNA, prevent DNA from being separated and thus cancer cell not progress. Pharmacokinetics is clearly mentioned here. Major adverse effect of myelosuppression. Some individually adverse effect are mentioned here. If you like that video, do share, like and subscribe. Follow on Instagram your med tutor medminder. See you in next video. Till then, stay tuned.